Hello and welcome to the MedSight Bootcamp. In this video series, I will try to give you guys some real-life practical tips on how to reduce anxiety and depression. So I think it's important to start off by asking, what is depression? So in this first part of the bootcamp, I will try to explain what depression and anxiety are, their prevalence, how they are diagnosed, and some of the treatment options there are for them. I think an important disclaimer is that the purpose of these videos are not to be giving medical advice. Rather, I want them to serve as an educational tool for you to use to better understand these conditions, and hopefully some practical ideas you can use to mitigate these challenges that you face. So depression and anxiety are two of the most common mental health disorders, which can have significant morbidity and impact on one's quality of life. And depending on where you look at in terms of the world and what kind of demographic you can look at, the prevalence of depression and anxiety can be more than 15% in the general populations. So I think we need to start off by asking, what is depression and anxiety? So starting off with depression, as defined by DSM-5, is a persistent feeling of sadness and hopelessness and loss of interest in activities people have once enjoyed. And aside from the emotional problems caused by depression, individuals can also present with physical symptoms. Now, to diagnose depression, physicians often use the DSM-5 criteria. So the DSM-5 outlines the following criteria to make a diagnosis of depression. And the individual must be experiencing 5 or more symptoms during the same 2-week period, and at least one of the symptoms should be either 1, a depressed mood, or 2, a loss of interest or pleasure. Now these are the following symptoms. Number 1, a depressed mood most of the day, nearly every day. Number 2, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Number 3, significant weight loss when not dieting or weight gain. When not dieting or weight gain, or decrease or increase in appetite nearly every day. Number 4, a slowing down of thought and a reduction of physical movement, which is observable by others, not merely subjective feelings of restlessness or being slowed down. Number 5, fatigue or loss of energy nearly every day. Number 6, feelings of worthlessness or excessive or inappropriate guilt nearly every day. Number 7, diminished ability to think or concentrate or indecisiveness nearly every day. And number 8, recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. Now, to receive a diagnosis of depression, these symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. The symptoms must also not be a result of substance abuse or another medical condition. Now, the PHQ-9 questionnaire, which you sometimes also see when you read up on depression, can also be used to screen and monitor depression in patients. Moving on to treatment, common treatment options for depression are psychotherapies such as cognitive behavioral therapy or CBT, and medications such as SSRIs and SNRIs. It is important to note that there are other therapy and medications available, and these are dependent on the patient, their medical condition, their preference, and their ability to cope with the medical side effects. Now, moving on to anxiety, or in medical terms, what we call generalized anxiety disorder. This is characterized by excessive and persistent worrying that is hard to control, which causes significant distress or impairment and occurs on more days than not for at least 6 months. Other features include psychological symptoms of anxiety, such as apprehensiveness and irritability, and physical or somatic symptoms of anxiety, such as increased fatigue and muscular tension. Now, the criteria for diagnosing GAD, as stated by the DSM-5, is the presence of excessive anxiety and worry about a variety of topics, events, or activities. Worry occurs more often than not for at least 6 months and is clearly excessive. The worry is experienced as very challenging to control. The worry in both adults and children may easily shift from one topic to another. The anxiety and worry are accompanied with at least 3 of the following physical or cognitive symptoms. In children, only one of these symptoms is necessary for a diagnosis of generalized anxiety disorder. And these symptoms are edginess or restlessness, tiring easily, more fatigued than usual, impaired concentration or feeling as though the mind goes blank, irritability, which may or may not be observable to others, increased muscle aches or soreness, difficulty sleeping due to trouble falling asleep or staying asleep, restlessness at night, or unsatisfying sleep. And excessive worrying means worrying even when there is no specific threat present or in a manner that is disproportionate to the actual risk. Someone struggling with GAD experiences a high percentage of their waking hours worrying about something. The worry may be accompanied by reassurance seeking from others. In adults, the worry can manifest regarding things such as job responsibilities or performance, one's health issues or the health of family members, financial matters, and other everyday typical life circumstances. In children, the worry is more likely to be about abilities or the quality of their performance, for example, in school. Now, the Generalized Anxiety Disorder 7-item scale, or the GAD-7, is also a great tool which is similar to PHQ-9 to screen for generalized anxiety disorder in the primary care setting. And medications for GAD are similar to depression, which include CBT and medications such as SSRIs and SNRIs and others. So that's the end of kind of defining what anxiety and depression are. Congratulations on finishing the first part of the video series. And in the next videos, I will be talking about practical, real-life tips and tricks I use to manage my own anxiety and depression. It is important to note that this is not meant to provide medical guidance. You should always speak with your family doctor first. My goal is to provide insight as to how you can manage, mitigate, and cope with your own depression and anxiety. I want you to take control of your life, to live happy, relaxed, and confident. Welcome to MedSight.